So today we're going to talk about the relationship between diabetes and a patient that contracts COVID-19. So a diabetic that would contract COVID-19. There's been a few studies. The first one came out of Wuhan, China, where it showed that a significant amount of the people that died were diabetics. There was another study that came out of the United Kingdom, and that study involved about 24,000 people that had died, and 30% of those people had diabetes. The Italian group looked at diabetes as well, and it showed that patients that were admitted to the hospital tended to have high blood sugars. In fact, those patients that had very high blood sugars tended to either be admitted to the ICU and eventually were on the ventilator and passed away. And so there is a significant association between the patient that has uncontrolled diabetes and contracts COVID-19. So the key here is not just diabetes. The person that has diabetes and their blood sugars are well controlled, no problem. The patient that has diabetes and their blood sugars are above 180, 200, big problem. So if you're a diabetic and your blood sugars are out of control, your A1C is really high, we got a problem. This is the time that we really have to look at these other conditions, because those could be a problem for the person who has diabetes and contracts COVID-19. What about obesity? How does that play a role with COVID-19? What happens to that patient that has that's overweight and contracts the virus? Well, one of the largest studies that have been done in the United States thus far consisted of patients from 14 different states. What they found was there were significant amounts of patients that had high blood pressure, diabetes, and obesity. In fact, the study showed that the patients that had excessive obesity were at 2 times the risk of being admitted to the hospital. So the more weight, the more their probability of being admitted. In fact, the study went on to show that the higher the weight, the more weight they carried, the chances of them dying were 4 times that of a person that didn't carry that much weight. Okay, so what that shows us and what that tells us is that right now we have some things to do as a community, as people living with this pandemic of COVID-19. One, diabetes. We need to have that controlled. Our blood sugars need to be running less than 180. Certainly, it would be great if our A1Cs, which are indicators of what our blood sugars are, were running below 7. That means your average blood sugar is running about 130, 140. How do you do that? Cut the carbohydrates, potatoes, rice, pasta, bread, all those good things that we like. And then when we look at obesity, we have to drop the weight, because we already know that all these different studies showed, and these were people that were from all across the United States, and it was the largest study that has been done with patients with COVID-19. Let me tell you why that happens. When you carry a lot of weight in your abdomen, you have a diaphragm. The diaphragm separates your stomach from your lungs. So it's a muscle kind of right in the middle there. Now, if your abdomen is large, when you take a deep breath, your diaphragm can't go down. And if your diaphragm can't go down, then you can't, the lower 1/3 of your lungs is not accessible to oxygen and the CO2. That important, there's a lot of, the exchange of oxygen and CO2 is really important in that lower third of the lungs. And so if we can't lower the diaphragm because our abdomens are too large, then we're just working with 2/3 of our lung for the most part. So that is the whole, and you can kind of see why a person that is obese and they can't expose all of their lung field for oxygen and carbon dioxide, you can see why that would be a problem if they were to contract COVID-19. So let's keep our diabetes controlled, get those A1Cs low, have those blood sugars running low. Let's try to exercise as much as we can. I know in some cases that's a little difficult because of the situation, but let's keep the bodies moving, watch what we're eating, and we're going to do better if we were to get COVID-19. So if you like this video and you would like more information, follow us on the link below. Thank you.